Good afternoon to every one of you and welcome to today's Facebook Live Talk, Digital Breast Tomosynthesis, More Than an Exam and Experience. Thank you all for finding time and visiting today's live talk. My name is Denise and I'm a dietitian at Assunta Hospital. It's my honor to be the moderator of today's live session. I'm pleased to introduce today's speaker, Ms. Elina Lo, who is currently the Radiology Manager at Assunta Hospital. Ms. Elina Lo is graduated from University Kebangsaan Malaysia, UKM, with Bachelor of Honours in Diagnostic Imaging and Radiotherapy. Later on, she gained her Master of Business Administration MBA qualification from Cardiff Metropolitan University in UK. She is an experienced radiology manager with extensive history of working in hospitals and healthcare industry. Throughout her years of administrative and managerial experiences in hospitals, she gained high level of respect and loyalty from her employees through her positive leadership style. Here's a little housekeeping before we get started. If you have any questions during the live talk, please do not hesitate to type them out into the comment box below this live video. I'll bring them up at the end of the talk and they will be answered by Ms. Elina. And also, please give a like to this live video and share it out to your friends and family so they can view our live session. Now, without further ado, we'll turn the time over to the speaker of the day, Ms. Elina Lo. Ms. Elina, the floor is all yours now.
Thank you, Ms. Denise, and a very good afternoon to all my FB Live friends, and thank you for logging in to today's FB Live broadcast from Assunta Hospital. As introduced by Ms. Denise, my name is Elina Lo, and I'm currently a Radiology Manager based in Assunta Hospital. I have 20 years of experience in radiology services and 14 in management. Today, our topic of discussion is about mammogram. Okay, when we talk about mammogram, the first thoughts that come into our mind, usually the discomfort process and the pain associated with it. Therefore, it is essential for us to understand mammogram in details. These details could help us to understand and to make a better choice in deciding which mammography center around us that best suit us. Today's discussion, I will cover on what is 2D mammogram and what is 3D mammogram. What are the differences and advantages to mammogram experience and how could we benefit from it? Generally, when we discuss about 2D mammogram, 2D stands for 2 dimension and 3D mammogram stands for 3D dimension. That's about it, right? But in mammogram, 2D is a static images which you obtain from a single compression, single exposure. The outcome is a single slice of breast tissue. That is 2D mammogram. Yeah. For 3D mammogram, however, you obtain the images from a different angle of X-ray tube. Okay, your X-ray tube will actually swipe from the left to the right. Therefore, there are multiple layers of breast tissue images you can obtain, and each slices actually are in 1 mm thickness. Okay, so they are the difference here. 2D is a static images comprised of a breast tissue that the radiographer compress. 3D is multiple slices of breast tissue under one single compression obtaining from a different angle of X-ray tube. All right, let us discuss further on 2D. A conventional 2D mammogram shows all the breast tissue at a glance. Therefore, we call 2D mammogram as a static images with a volume of breast tissue. That means one feature can hide in the shadow of another. Okay. In 3D, however, you are showing the breast tissue in a thin layer. Okay, the thin layer is actually a 1 mm thickness. Therefore, almost like turning a pages in a book. Okay. Therefore, we mentioned that 3D images can help us to actually obtain more information. Instead of a volume breast, we are actually viewing the images in 1 mm thickness of multiple slices. Therefore, early detection is possible in 3D compared in 2D. All right, let's go to 3D tomosynthesis principle. Yeah. Now, principle of tomosynthesis or three-dimension tomosynthesis, yeah, as I mentioned just now, the X-ray tube is actually moving from left to the right. Yeah, you are swiping from left to the right. So you can see here, every single dot over here is actually 1 mm thickness of the breast tissue. Okay, therefore, X-ray tube moves through an arc while acquiring images. Okay, therefore, these are the multiple layers of breast tissue. Images taken from different angles, yeah, angles from here, left to right. So every dot over here will contribute every single slice over here. Reconstructed into a range of tomosynthesis slices where structure of interest. You can see this? Structure of interest is always in the focus. Okay, now you can see here 2D images is a volume of breast tissue. Therefore, all the region that you want to see is actually overlapping each other. Okay, the lesion you can see over here is overlapping each other because it's a breast volume. In 3D images, however, you are viewing the images in slices. Therefore, you are able to identify each lesion in 1 mm thickness, clear and prominent. Okay? Now, this is the tomosynthesis images example. You can see the lesion over here from the start. And in 1 mm interval, this is the meat of the lesion. Okay? Then this is at the edges of the lesion. Okay, under one single compression. Okay, therefore here we can conclude that 3D images will provide us a better information, delineate the lesions that we want to see clearer, okay, compared to 2D images. So this is the first advantages of 3D compared to 2D. Let us move on our second benefit of 3D. The second benefit of 3D that I'm going to discuss over here is actually depends on the technological innovations. In Assunta Hospital, we actually invested in a Hexagon Pixel of detector compared to a conventional square pixel. Yeah. Before we go further, now over here we have a dual mode of tomosynthesis. Okay. There is one first mode here, standard mode. The second is a high resolution mode. The differences between these two is the coverage angle. You can see over here, standard mode, you cover 7.5, 7.5. Okay, now 7.5 to the left, 7.5 to the right. Imagine this is the normal curve of a single breast. Okay, when I mentioned about the midline, it's always at the highest peak of the middle of the breast. When you swipe to the left, you go to the left 7.5, you go back to the middle, you go to the right 7.5 over here. Okay? Now, when you mention 20, from the midline, you actually swipe 20 degrees to the left, go back to the middle, 20 degrees to the right, go back to the middle, all right? Each point, you're actually obtaining a single slice of images with 1 mm thickness apart. Now, what is the difference between standard mode and a high resolution mode here? Standard mode normally we recommended to the women that undergoing a screening, follow up. Yeah. However, in high resolution mode, we recommended for the women that have underlying abnormality. Okay. The differences between these two is the coverage of the angle and the duration of the exposure. Okay. 7.5. Yeah. We actually require 4 seconds. Yeah. For 20-degree angle, high resolution, you require 9 seconds. Okay, so there are the differences. Yeah. So the first one, 7.5 for screening, 9 seconds is for morphology. Okay. Now we go to our second advantage, Hexagon Pixel. Okay, so this is the second innovation technology we have invested. Instead of we going using the square pixel, yeah, over here you can see the square pixel. We are actually invested a Hexagon Pixel detector. All right, this is how the pixel line up in our detector over here. You can see here is a square pixel. Then over here, you can see that it's a hexagon pixel. And how could we benefit from the hexagon pixel compared to the square pixel? Yeah. So this is the images that we captured you can see the star over here from the square pixel, and you can see the star over here is the same images that you obtain through the hexagon pixel. You can see the peak, yeah, compared to the peak of the square over here. You can show a sharpness. Therefore, you can show a better information through hexagon pixel compared to a loss of information in the square pixel over here. Yeah. Or not only at one side, you can see all over here. Yeah. Over here, we can conclude that hexagon pixel actually can give us better information. You could obtain more details, more information in a single compression compared to the conventional square pixel. The images that you obtain should show this type of details. Yeah. And once you magnify the region of interest that you are interested, yeah, you shouldn't lose any resolution. The details that you magnify should be the same as the raw images. Okay. This is the second advantage of hexagon pixel that we have invested. The third advantages, 3D tomosynthesis that we have invested, lie on AEC. Okay, let me define what is AEC. AEC is automatic exposure control. Why AEC is important? AEC is important because we are using AEC to provide us or to deliver a consistent and adequate dose exposure to the patient. When we mention adequate, we don't want the images that is underexposed, or we don't want the images that is overexposed. When we mean images of underexposed, that means the images is inadequate, a low quality, because the dose exposure that release is not sufficient to penetrate that region of interest. Okay, so when we mention about overexposed, that means it's too high exposure given to the radiation, given to the region of interest. Okay, when you give too high exposure, the images come out will be too dark. All right, so inadequate image quality again, and then the patient will experience unnecessary dose exposure. Okay, therefore this AEC will actually help us to calculate the adequate dose exposure based on the size of the region that you want to be included and the thickness of the breast density that they require you to penetrate. Okay, patient will receive adequate dose. Yeah, image quality is the optimum. That is the function of AEC. Now, instead of invested in AEC, we invested in intelligent AEC. In the short form, it's an IAEC. And what is the function of IAEC? We are using IAEC to cater for women that have an implanted breast or implanted silicone. Yeah. IAEC is a very smart system. Okay, when we compress that particular breast, IAEC will able to identify there are two different compositions in one single compression. That means there is a silicone composition, there is a breast tissue surrounding the breast silicone. Okay, so they will have to calculate, adequate dose exposure to penetrate the silicone. At the same time, do not overexpose the breast tissue. That is the function of IAEC. Okay, as you can see in my slide here, when you press the IAEC, when you selected the IAEC, all right, when you compress that individual breast with the breast silicone, IAEC will do a background algorithm. Okay, they will analyze the mammary gland structures, fat density, and the existing of the implant, and calculate the exposure that can give the optimum of level of doses for the breast tissue without compromising the image quality. Okay, so that is the IAEC, intelligent AEC. Therefore, we are able to cater for implanted breast or implanted silicone women. Yeah. So we have covered the three advantages of 3D tomosynthesis in comparison to the 2D in the market. The last advantages, 3D tomosynthesis, that I want to share in today's presentation lie on our compression pattern. As you reflect back from the start until now, I never mentioned that compression is not necessary. Compression still is necessary for mammogram examination. Okay. Now, we require a compression because we need to spread out all the breast tissue adequately. Okay. We cannot avoid a compression. Therefore, we invested on conformal breast compression paddle instead of conventional compression paddle. Okay, now as you see from my hand over here, all right, a normal structure of a breast tissue having a curve at the both edges. Yeah, there's a normal structures of the breast. Yeah, so a conventional breast tissue is always curved like this. Then a conventional compression paddle are applied, are compressed on the breast tissue and flatten the breast tissue. Okay. They're required to flatten the breast tissue so that they can obtain an adequate breast thickness. Yeah, so that the exposure they introduce are the same. But instead of we flatten the breast tissue, conformal compression paddle is actually applied to confirm the breast curve at the both sides. So when we are applying the compression paddle, it does compress, however, but it will curve, it confirm instead of it force the breast tissue and flatten it. So in that sense, we actually try to minimize the compression factor to the patient while still obtaining an adequate thickness. Okay, so these are the 4 advantages of 3D tomosynthesis. Now, when I mention about conformal compression paddle, this is exactly compression paddle that we are having in our hospitals. And you can see over here, there's a curve at both edges. All right, so instead of we force to flatten the breast tissue, we conform to the curve of breast structure to provide us adequate thickness before we introduce a dose exposure to the patient. So today's presentation, I actually covered 4 important factors. The first one, the 3D compared to 2D, which you actually replace the image static of 2D with a multiple layer of breast with 1 mm thickness. Okay, so you're able to see more information out of single compression instead of one volume breast tissue that you might have a hidden underlying tissue. This is the first advantage. Okay, the second advantage is over here. Yeah, we are actually invested with a hexagon pixel detector instead of square pixel. Yeah, so you can see the edges clearly. You can delineate the border clearly compared to the square pixel. Okay, so the third one we invested is on the IAEC. Okay, therefore we can cater for women that having a breast implant or breast silicone. Okay, the fourth one is our conformal compression paddle. So we have 4 advantages over here. The reason why I actually have a summarize of these 4 advantages because as we all aware, mammogram services are very much available in everywhere else hospitals. What makes us a niche in the market is these 4 advantages in mammography services. Okay, for that, I end up my presentation today, and thank you once again by taking time and joining my live session. I'll hand over my session to my colleague, Ms. Denise. Thank you.
Thank you, Ms. Elina, for delivering such an informative talk on digital breast tomosynthesis. Now we'll go ahead and take some time for questions now. As a reminder, you can still submit your questions into the comment box below this live video so they can be answered by Ms. Elina. Looks like we have a few questions here. Our first question of the day will be, why compression is necessary during a mammogram? Ms. Elina?
Yeah, compression is still necessary. The first reason we need to apply a compression, as I mentioned just now, we need to spread out the breast tissue because our normal structures of a breast is actually curved at the both edges. Yeah, so we need to actually apply a pressure on the breast so that we can have approximately thickness of the breast tissue, because the dose exposure is depending on the breast tissue thickness. The thicker the breast it is, the higher exposure they need to required to penetrate the breast tissue. Okay, therefore, we will try to actually compress it to a certain thickness to reduce the dose exposure required for the penetration. All right. Second reason why compression is required, because there is a breathing movement, and probably patient will jerk a bit when my tube is moving. Yeah. So we want to compress that region of interest to minimize as much as possible the movement of the breast. We don't want breast images captured with blurring. Okay. The third reason, which is much more significant on the conventional 2D rather than 3D, because they need to spread the breast tissue because they are obtaining in 2D volume breast tissue. But in 3D, however, this reason not really a significant, because you actually are cutting particular breast tissue in 1 mm thickness. Okay, so these are the 3 reasons why compression is still required. However, with our conformal pedal compression, we try to minimize the compressions that we need for each of single breast to reduce the pain or to reduce the discomfort that women are going to experience.
Thank you, Ms. Elina, for addressing this question. And I think it leads to the next question from our floor, which is the compression procedure really painful during the mammogram?
Okay, as I said just now in my discussion, generally when we discuss about mammogram, the first perceived thought is always discomfort and the pain associated with it. We do acknowledge this concern, and rest assured, so am I as a woman myself. Therefore, it is worthwhile for us to invest our time to understand the mammography center that around us, what system they are having, what services they can provide to us, because all the factors I introduced just now, or all the factors that I discussed just now, does really contribute to the differences of your mammogram experience. Now we go back to the question, is mammogram painful? It is a very subjective question. So we do have a patient that can tolerate the compression. We do have a patient that's saying it's a pain. Therefore, I will say that the services provided, the technology that the hospital invented will help you to ease your mammogram journey. So it is advisable for you to spend your time to investigate, to understand more before making your appointment with your mammogram center.
Okay, so the next question is, why can't I wear talcum powder or deodorant during the procedure?
This is a common preparation we will inform our patient, because talcum, lotion, deodorant, perfume, it might contain substances that when we capture under X-ray images, it might look like a microcalcification. So it will cause a confusing or unnecessary alarm that sometimes in certain scenario, we will require to call the patient back to undergo extra examination. Therefore, during patient preparation or during the patient appointment, we will advise the patient do not apply talcum, deodorant, lotion, perfume at the armpit area and at the breast region during your appointment day.
So in short, talcum or deodorant application during the procedure can actually affect the accuracy of the mammography images.
It does, because the substances mimic the macrocalcification in our X-ray films.
Okay. I think we have another question from the floor, which is, can menstrual period affect the mammogram appointment? And I think it's an interesting question.
We do have a lot of questions. And as you're aware, if you are making your mammogram appointment, normally we will ask about your last menstrual period. Yeah? The reason why is because during the menstrual week, because of the hormone fluctuates, probably, yeah, your breast tends to be a bit engorged. Yeah. So when your breast tends to be a bit more engorged, your sensitivity is high. So imagine if I'm actually compressing the breast during your engorged breast, that will cause more discomfort to that particular woman. Therefore, it's always advisable to have your mammogram booked a week after your menses. Yeah, a week after your menses.
It looks like we have covered all of the questions. Miss Elina, is there anything else you would like to mention before we wrap up the whole session?
Yeah. As I emphasized during my discussion, it is worthwhile for us to actually invest a bit of more time to understand the mammography center around us, because it does help us through our experience. Yeah, because by one compression, of course, by going through all this discomfort process, the time spent on this examination, we want to get the best out of our examination. Okay, instead of the pain and discomfort, you want to get the best analysis of the images. Therefore, I will strongly recommend that all women outside there, yeah, rather than shy away from the mammogram examination, we better go and understand what is mammogram, why it is required and important, and go and search around a mammography center around us and choose the best for us. Thank you.
So with that, we have come to the end of our live talk today. Thank you again to Miss Elina Lo, our speaker, for addressing such an interesting topic. And it definitely gives us better understanding on how does digital breast tomosynthesis or 3D mammography works. And if you're interested in getting yours done or have any inquiries, please do not hesitate to book an appointment at Assunta Hospital and to receive our services. Thank you all for staying here with us today, and I hope you all have a wonderful day ahead. And hope to see you again in our next live video by Miss Tracy Cheng, our dietitian, on the topic of Eat Well, Live Well. Thank you all and bye.
Thank you.